Ooh, look at that bee. And will you go tell Mom to get the first aid kit?
Get the first aid kit.
I got a boo-boo.
Hi, Mary Lou here, and today in ideas and things about home, I want to talk about first aid kits. And every home should have at least a basic first aid kit. And so I'm going to talk about some of the things that every home ought to have, and then I also want to talk about some of the things that over years with several kids, things that really came in handy for me with injuries and other things. So we're going to start with a basic first aid kit, and then we're going to go on and I'll show you a few other things. So this basic first aid kit I really like because it's one that you can just basically fold up and go, and this has a lot of the basics that every family would need. And so let's just start over here. So we have, of course, Band-Aids, gauze pads. You can't have too many gauze pads, I think. Butterfly bandages, and also it's good to also collect bandages of other sizes and types. Lots of skinned knees in our family, lots of cuts and bruises, and so I think an assortment of lots of sizes of bandages is a really good idea. Then also in this kit, we'll just kind of look down here, we've got a cold compress and the cold gel thing that can go in the freezer. These expire, and so if you've had it a while and you're seeing it starting to balloon up, it probably has expired and it's time to replace it. And there will always be an expiration date on there so that you know actually if that pack is still going to work. And then we have in here, of course, more gauze, bandages, roll-ups, and this is great for a travel kit, but you're certainly going to need more than that at home if you have children, and so you want to be well supplied. We have this ACE bandage in this size, but we also have the bigger one. I would say we have used this one more often, and make sure you've got the butterfly clip thingies to close it up. Okay, and then also in this kit, I have in here some Coban. This is a type of tape that sticks only to itself, and you've probably seen this when you've gone to get a blood draw, but it sticks only to itself, so you could wrap something and it doesn't ever stick to the skin or leave adhesive on the skin. And when I first started in the medical field, I worked for many years as a respiratory therapist, mostly in ER, pediatrics, and newborn intensive care. We use this a lot, and this was how it came, but nowadays it comes in a lot of pretty colors. Then you need this adhesive tape, medical tape, that will help hold down gauze. It sticks to gauze. And then I just put in here a couple of different sort of multi-purpose antibiotic ointments. One is basically in an essential oil form, and then this other one is as a gel in this form, and then I also have it as in a tube. So these are, we use this so much, and so have some kind of all-purpose antibiotic kind of ointment. Okay, and then also in here we've got tweezers, always scissors. Make sure they're very sharp, because to cut gauze you really do need sharp scissors, and so make sure those are in there. Keep on hand any like Tylenol, Advil, some kind of pain reliever. A good hand lotion is a great idea for dry skin, sore skin, sunburns, and those kinds of things. A really good hand lotion, a healing hand lotion. And then we have in here a different antibiotic ointment and lip balm. So it's a good thing to have lip balm on hand. Now I also keep on hand a insect bite relief pen where you can just rub it right on the bite. It helps take away the sting and the itch, and always a very good quality insect repellent. Now, insect repellents, a lot of them have very dangerous chemicals in them, so I always look for a very effective insect repellent, but that's also safe. And so look around for that. And any questions, I'll put my email below if you have any questions about where I got my supplies in this kit. Okay, so that's kind of a basic, let me see. I would put this also in basics. This is, of course, a thermometer. Every home should have a thermometer. Make sure that it's accurate, and you can get a thermometer in either Fahrenheit or Celsius. Just make sure you're using one that you are familiar with. And if we had one that worked in Celsius for many years, and I just had the conversion from Celsius to Fahrenheit right there, so we were really clear on where that person was when we took the temperature. I also think you should have some things for the eyes. We always keep on hand eye drops, or basically it's just a saline solution to wash out the eye, or for really dry eyes, or for someone that's been in the sun, their eyes are dry. It's good to have some kind of saline solution, and an eye wash little cup. And that has come in handy so many times. We actually have 3 or 4 of these. This one just happens to not be open, so I keep it in the travel first aid kit so that we always have that handy. Okay, so let's just look at a few other things that maybe aren't going to come in your day-to-day first aid kit, but you probably ought to have on hand. So 2 things maybe to have on hand would be hydrogen peroxide for washing out wounds, cuts, scrapes, and also rubbing alcohol. Now, I tend to use hydrogen peroxide more. It tends to be less painful, so I keep both of those on hand all the time at home. Another thing to keep on hand is a triangular bandage for supporting an arm that's been injured. That's just, it's kind of just a good standby kind of thing. And of course you could use a dish towel or something. This particular bandage is just made particularly for resting an arm in. Okay, now we are all very much more aware of sanitation, so a really good quality hand sanitizer gel is a great idea. Make sure it's something that no one in your family is allergic to, or that the smell isn't too offensive. There's so many out there now, so look for a good quality one. In our family, this comes in super handy. It's called an Emesis bag or an Emmy bag. It's basically for barf, and so it's good to have on hand, especially when you're traveling. If you're in the car and someone's getting sick, that's just kind of a handy dandy thing to have on hand. Of course, gloves, and most first aid kits now come with some gloves, so we just tend to buy the whole box because we go through them pretty quickly. And in the realm of bandages, these are 2 things that I started buying when my kids were younger, that they just have been so very handy. So the first one is, there's 2 versions of it. One is called Opsite and the other is called Tegaderm. And what it is basically is so you can see, it's a clear bandage that can go right over a wound. So let's say someone had a cut, and especially on a knee or someplace where it's in an odd place, you can go ahead and put down your gauze or your non-stick pad, and then this goes right over it, right onto the skin, and circles it so that it will keep that bandage on, and it works really great, especially in wounds that maybe might need a bandage left on for a while. So they both work kind of the same way. They just cover large wounds or keep gauze in place. So those are good. Those you're probably not going to find at your typical Walmart, Target, Fred Meyer, but anything that you can't find there, you can get online or email me and I'll let you know. The other thing that, in fact, we used just yesterday are SteriStrips, and you see these in the emergency rooms, and they're just little tiny strips that hold up really well, and they're not waterproof but water resistant, and they hold 2 flaps of skin together, and they stay on for several days. And I first saw those when I had taken a child to the ER because of a pretty bad cut on by his eye, on his eyebrow, and I first saw those SteriStrips being used and went, so I was able to track those down online. And so those are super, super handy. Just in an emergency situation, we recently took a first aid class, and this is kind of what's going on now for rescue breathing, so that this could cover mouth and nose, and then you actually breathe through the port, so that you're not putting your mouth right on someone else's mouth in an emergency. Now, if it was your own child, it probably wouldn't be that big of a deal, but with strangers or a neighbor or someone that you don't know as well, you might want to have that on hand, and it has this, comes in a handy bag. The kit I have also includes instructions and other things that help make that more useful and helpful. Something to have on hand in a kit with children is syrup of ipecac, and that causes vomiting. So if a child has ingested a type of poison, that it's okay for it to come back up, that can induce vomiting. Before using this, always call poison control. And I actually should have that in here, the number for poison control. I've called poison control a few times in my life. They're great, they answer quickly, they ask the right questions, and they have all the resources they need to find out exactly what to do about whatever was ingested. Okay, so then a lot of people now are relying on things also like essential oils. And so if you're going to use essential oils, make sure you get a really good quality one. You really get what you pay for in an essential oil. And so there are books, all kinds of things about how to use them. And so if that's something you're interested in, that you could learn a lot more about that. And you can get all kinds of interesting containers now. This is a roll-on. You basically have your oil in there, and you can just roll it on to wherever you need it. So that's certainly not necessary, but if you're interested in that and you're looking at more natural ways to handle first aid emergencies, have a look at that. Another good thing to have on hand is moleskin. This is to protect from blisters. If you're getting sort of a hot spot on your foot during a hike or whatever, that's good to have. My daughters who did ballet used moleskin a lot, and it's actually really helpful and handy. So good thing to have on hand. Okay, now let me just talk about a few pieces of equipment that you certainly don't need, but boy, I'm glad I had it when my children were growing up. Now, I worked medical for many, many years, so I know how to use this equipment. If you are not familiar with it, don't even bother with it, you know, just leave these out. But boy, I'm glad I had these things when my children were younger, and even now. So I was able to get several years ago an otoscope so that I could just take a quick look in my children's ear. I had already learned how to use it. I was very careful about it. I actually, one day when I was at the pediatrician, I had a son who had chronic ear infections that just would not go away. So I talked with the doctor about it, He instructed me very carefully in how to use the otoscope, what to look for, and so that when we came in with yet another ear infection, I could give some information about that. So I thought that was super handy to have on hand, but you don't need it, but nice to have. I love having a stethoscope on hand. I spent a lot of years listening to people's lungs and heart, so I have that on hand. And also, one thing that I've used so frequently is basically a blood pressure cuff. I've taken thousands of blood pressures in my life, and so I'm glad to have that here at home. I can check blood pressure. And then the last thing I want to talk about is this saturation monitor. Sometimes they call it a SAT monitor, and you've seen it. You put it on your finger, turn it on, and it'll tell heart rate, but more importantly, it tells how much oxygen is in the blood. And so that you can buy that at your local pharmacy, and it's a good way. We have some asthma in our family, and so it's a great way to keep track of if someone is having an issue with asthma. We can determine whether their lungs are functioning and they're moving oxygen, or if they're getting into trouble. Now, one thing I really wish I had, I would have slept better and did not have when my children were very little, but now you can get a little sock. It's called a smart sock, and it's called Owelette Smart Sock. And basically it's a little sock that you can put on a baby's foot, a newborn's foot, clear up to a few years old, and you can put it on their foot, and it will read their heart rate and their oxygen saturation, and then it alarms if either of those drop. And I know there were times I just was worried. I had a hard time sleeping because I thought, oh, is my child breathing? And I think it would have been nice to have a little something to warn me in case there was a problem. And so I just would like to recommend that to maybe help you sleep a little better at night if you have a new baby or very young children, that it isn't a protection from everything. It isn't something that, is the be all and end all of taking care of your child's health, but it would be a handy little something to have along with your first aid kit. So there you go. Make sure you have at home things you know how to use and things that you can use. But at the very least, I really do recommend just that really basic, easy to carry travel first aid kit that really can help you in the car, on vacation. It can go in a suitcase if you're checking it, because it does have scissors in it. And so get together, do it right away. Don't let this be one of those things where you go, oh yeah, I've got to get around to that someday. Do that, make it be something that you do today to get everything together. We have a cupboard that is dedicated to first aid items. We've had a first aid kit in basically a bait box for fishing. We've done it in a lot of different ways, but get it together. Start with a few basics, and then every week or so add on one more new thing until you have a complete first aid kit. So also, if you email me in my email below, I will email to you a first aid kit list of basics that every family ought to have, and you can get that if you just send me an email at the email below. So I hope you get your first aid kit together and that you do all you can to help keep your family safer, and we'll talk to you next time.